Texas hospitals are overwhelmed with COVID patients, and the number of patients in Austin area ICU beds has exceeded capacity. This has made it difficult for doctors to transfer COVID and non-COVID patients for proper care. Here to talk about this is Dr. Jeremy Gabrish, director of the emergency clinic in Lavernia, which is just east of San Antonio. Doctor, thanks for joining us.
Thanks for having me, Mike.
Could you explain to us what is going on at your facility?
Well, we are seeing record numbers of patients, 3 to 4 times what we would typically see in an August and September timeframe, and most of it is due to COVID.
What sort of impact is it having on your freestanding ER?
Well, the increased volume certainly means that, we are busier than ever before, but also we are having sicker patients who need to be transferred to ICUs here in the state. And frankly, the ICUs are full, and it's very difficult to find beds for these patients. And we end up caring for them far longer than we should.
And you have patients, so are you receiving patients from the hospitals as well? Or, kind of explain, I'm just trying to get an idea of how the day-to-day has been interrupted and changed because you've got so many people in these ICU beds with COVID.
Well, so we're a freestanding emergency room, which means we work a lot like a hospital-based emergency room, but we're just not attached to a hospital. So in our community, for example, we're the only facility that's seeing, patients, emergencies that come in. And typically we would stabilize those patients when they need to be admitted or transferred. We would start working on that process, which would usually take around, an hour or so. Now we're, finding that patients stay with us up to days sometimes while we look for an available ICU bed around the state to send that patient to.
Are you receiving patients from hospitals who are running out of room and they're asking you, hey, can you watch these patients for us because we don't have the room?
Well, we don't receive patients from hospitals, but I would say that we are in fact so we're seeing patients that come to us from the community, but then these patients then need to be admitted to the hospital, and we end up, caring for them in that interim period while we're waiting for them to get a bed in the ICU.
What is the breaking point for your facility?
Well, I would say we're doing quite well, despite the increased volume and the strain. I mean, we've got all the facility and equipment that a typical hospital-based emergency room would have. So we're able to do pretty much anything that they would do at the hospital and then some. It's been, a challenge unlike any I've ever seen in my career. Most emergency room doctors would tell you that, where we're caring for patients for days when we would typically be handing them off to the intensive care service. But we're up for it. We're taking care of people. We're ordering equipment and medicines that we haven't typically stocked in order to take care of those patients like they were in the hospital.
Are you expecting things to improve or get worse in the coming weeks?
It's really hard to say. I mean, it's so surprising to many of us that we were this busy in the summer. And typically when school starts back is when you would see a big influx of patients due to, typical cold and flu season ramping up. So I think, when you talk to many in the medical field, most of us are concerned that it's going to be bad for a while. And, we really want to figure out how we can most get patients who need critical care, find those available ICU beds and get them into those facilities when they need it.
Okay. Obviously, you and so many medical professionals are really stepping up at a very challenging time. So we all appreciate you for that. We are out of time for now. But Dr. Gabrish, thank you very much for talking with us.
Thank you for having me.